on this video, we're going to talk about the muscles in the lower leg and the ankle and foot. So a lot of these, just like we had when we did the forearm, right? A lot of these are going to cross the ankle joint, right? So we're going to start with a couple of big ones. So if he dorsiflexes his foot, so he pulls up, so you should be able to see there's a big tendon right here. So that's your tibialis anterior. So it's actually going to originate up here on the lateral portion of the tibia. So if he pulls up again, you should be able to see it. So there's that, I don't know if you can see that or not, but there's that muscle. It pops out for you right there. And it's going to run down, and it's actually the big tendon that crosses the medial part of the ankle. So notice lateral part of the tibia, but medial part of the ankle, and it comes underneath and it attaches at the base of that first metacarpal and the medial cuneiform. So it kind of hooks underneath here and helps you with, in addition to dorsiflexion, also helps with inversion of the ankle. So that's a big one right there. And then we're going to look over here on the lateral side, and you have your, again, what used to be called peroneals, and now we call them fibularis, right? So you have your fibularis longus. It's going to come from all the way up here at the head, and it comes down, and they loop right there behind that lateral malleolus. So if he everts against me, push the other way, then you'll see those tendons that kind of pop out on this side. It depends on your partner, right, who you're palpating with, but you should be able to feel those. So the longus is going to come down. It's going to hook behind that sideloid process of the fifth metatarsal, comes all the way under the foot, and attaches at that medial cuneiform again and first metacarpal. So it really pulls out. Now you have your brevis, which is going to attach a little bit lower up here for your origin, and it's going to come down to that styloid process. So you actually get a little fracture there called Jones fracture, where it pulls a little piece of it off. And then I don't think the book we use covers it, but there is a peroneus tertius as well that comes around and attaches into that peroneal tubercle that's there, or I'm sorry, fibularis tubercle that's there. So that's kind of that group, that fibularis group here on the outside. Obviously run along the fibula. All right, so on the posterior side of the lower leg, you have your gastrocnemius, right? So that's the big one. So if he makes a muscle, right, that's going to be the two that you can distinguish right here. So that's that big calf muscle. So it's going to originate up here at the posterior femur. It actually crosses the knee joint. It's going to come down to your calcaneal tendon. Normally we call it the Achilles tendon, which is going to then attach at the posterior part of the calcaneus. You also have your soleus. Soleus is going to sit right underneath that, and it's kind of a flat muscle that runs underneath it. It does not cross the joint, so it's going to start here on that posterior tibia, interosseous membrane, and come down to that tendon as well, that same calcaneus through the calcaneal tendon. Now we also have your tibialis posterior, so if we turn just a little bit this way, and you're not going to be able to distinguish it by him flexing or anything like that, but it does sit kind of underneath here as well. And if you want to feel that one, then you probably add in inversion to your when you're feeling it. So it's going to run down, and it's going to come behind that medial malleolus, and it actually spreads out and it attaches to basically all of the tarsal bones. So that's it, kind of like a little web at the bottom of the foot, spreads out and attaches down there. All right, so still on the posterior side, we have coming right there behind that medial malleolus still is your flexor hallucis, right? So it's going to come all the way down to that distal part of the big toe. So if you want to feel that one wiggle, if you kind of have him flex his big toe, flex the other way. So go that way and just kind of keep doing it. Keep flexing, and there we go. Then you will feel that move a little bit there on the right behind the medial malleolus. Now we also have with the hallucis, right? So we have the extensor hallucis. So that's going to run across the top. So it's easy to see if he just extends his big toe. So pull it up. Then you can see, go down to just a little bit. You can see the tendon right there. So you can see where that one's running. So that one's easy to find. And you also have your flexor digitorum, right, which is going to run back here and it's going to flex the rest of them, and then your extensor digitorum, which if he extends his toes, you'll see that tendon pop out here on the back side as well. So that's pretty easy to find, to palpate. So the next one we're going to talk about is the hallucis longus. So the hallucis is going to run kind of in this area too, behind here, and it's going to hook down. It's going to come all the way down to the end of that big toe, right? So that first phalanx, it's going to come there. So if you want to feel that one kind of wiggle behind the malleolus, if I was to have him bend his leg, and we could test his balance a little bit and have him just wiggle that big toe, then we may be able to feel that move just by doing that.